I'm Rolf Rosenkrantz. I'm the editor with Devex, and I'm here in Brussels at the European Development Days. And with me is Mercy Ehun, the special representative for GAVI eligible countries. Did I say that correctly?
Yes, you did.
Wonderful. So we're here in Brussels, and you are on a panel talking about cancer. Talk a little bit more broadly about the challenge of non-communicable diseases for the developing world. It seems to be one of the emerging challenges that health ministers will really have to deal with.
Yeah. Yes, I think we all know that vaccines are very effective against infectious diseases. And we also know that some cancers are related to infections. For example, hepatitis B, and then the HPV virus, human papilloma virus. And these two cancers, we have effective vaccines against them. We have hepatitis B, which can lead to liver cancer, and HPV, which can cause cancer of the cervix. GAVI has been supporting developing countries since 2001 to vaccinate children against hepatitis B. So you have a vaccine which is given in childhood and protects against cancer in adulthood. And we have recently also started HPV, which for a lot of countries is about demonstration projects, but we plan to scale up, and is given in adolescents to girls, and it protects adults against cervical cancer. I think the hepatitis B issue has been a success because we have supported countries to vaccinate about 360 million children against hepatitis B. We know that in China, for example, this has led to a major drop in the incidence, in the carrier rate for hepatitis B, and cancer was one of the countries with liver cancer as a major cause of death. So in a way, we are contributing to the whole issue of non-communicable diseases. We also know that there are some other infections associated with cancer. We have the Helicobacterium pylori, which is related to cancer. We also have hepatitis B, hepatitis C virus, and also the Epstein-Barr virus. So we believe that the work of GAVI, by looking at liver cancer and then cervical cancer, and then getting ready as more work is done on those either infections which are related to cancer, and by doing immunizations, which is about prevention, and we all know that prevention is better than cure. We are setting up the structures to relook at the way we do business. For example, in HPV, we have so far worked with childhood cancers, but for childhood immunizations. But for HPV, it's directed at adolescents. This is a completely new area for us because we haven't been giving vaccines to adolescents. But it provides opportunity to look at what kind of services, in addition to vaccination, can be given to adolescent girls. So some countries in applying have said, in addition to the HPV, we will look at youth-friendly health services. Others says we will also add deworming. So I think this is an important challenge and also an opportunity for GAVI and other agencies to look at how do we, in addressing the broader issue of non-communicable diseases and specifically cancers, work not just as GAVI, but bring in new partners to address the issue of non-communicable diseases.
Yeah, and I wanted to ask you about that really. Now, as aid organizations are working more on strengthening health systems, how does that change the GAVI partnership strategy?
Yeah, I think GAVI as an organization, we believe in learning by doing. And as we enter new areas, I said we started with childhood immunizations. We realized that actually to address issue of immunization long term in countries with fragile health systems, you need also to look at health systems. And so we are working with new partners in health systems. The WHO, World Bank, bilaterals like the Swedish Development Agency, and of course the UK government and different. They are partners who have been working in health systems for a longer time than GAVI. And so in partnering with them, both at the global level and then at the national level, we are learning what works, what doesn't work. For example, in Ethiopia, the issue of training health workers who are then living very closely to communities to provide services, basically reproductive and child health, including immunization. We learn what works and what doesn't work. And also with HPV, as I mentioned earlier, this is a totally new audience. And so we have about more than actually 30 partners, bringing in UNFPA, CDC, other partners that we haven't worked before, to look at the global level, how do we work together in a closer way, and also at the country level. For example, I just spoke at a panel discussion, and Marie Stopes International was the moderator. And previously we haven't worked with them, but obviously they have a lot of experience in reproductive health, so we have the opportunity to work closer.